Vanakkam, Namaste and welcome to Dr. Shah's Clinic. In yet another video on erectile dysfunction, I'm going to discuss a very important clinical topic to you and I'm going to answer a question. The question is how to get rid of erectile dysfunction, performance anxiety. What's very interesting here, as far as this particular question is concerned, is the fact that very large proportion of men, almost 20% or 30% of individuals who come to an erectile dysfunction clinic suffer from what's called as performance anxiety because of their erectile dysfunction. So basically what happens is the individual or the man in question would have tried sexual intercourse with his intimate partner or his wife or stable partner, and maybe a couple of times the sexual intercourse session might have resulted in a failure. He might have lost his erection. Because of that one particular event where there was a failure, the individual questions himself and has self-doubt. And what basically happens is every time he tries again, the self-doubt and the worry keeps building in him. And eventually what happens is every time he tries to approach his partner or his partner approaches him, what's going to happen is he's going to be worried or he's going to have what's called as performance anxiety about his erection. So basically these individuals, what basically happens here is that a vicious circle builds up. One particular failure or one event, and that leads to a cascade of failures and multiple events. And what ultimately these patients end up with psychogenic erectile dysfunction. Now, how can individuals with psychogenic erectile dysfunction overcome their erectile dysfunction or performance anxiety about their erection in general? Now, there are 4 quick tips that you should follow. And the first one is cut down on the alcohol and cigarette smoking. And if you're using drugs, please stay away from all drugs and all substance abuse, all items that can get categorized under substance abuse problems. Stay away from cannabis, marijuana, cocaine, weed, whatever you're using, if you're using. Tip number 2, ensure you go for 60 minutes of walking every day, because walking is what happens is with 60 minutes of walking every day, your testosterone goes up and even your ability to focus actually improves, and you'll have better concentration, you'll have more sexual desire, more libido when you're actually trying with your partner. Step 3 is to have a diet that is rich in protein and fat. When you take a diet that's rich in protein and fat, and when you cut down on the carbohydrates, you cut down on the sugars, you cut down on sweetened beverages, you cut down on the bakery products, the rice-based products, the milk-based products, and you take more fats, you take more protein, what basically happens is your ability to cope with anxiety is so much higher. Your mental stability, your mood stability increases tremendously. It takes about 4 weeks to see these effects, but it's proven and it actually works. Now, the most important tip is tip number 4. Now, basically, when a man, has performance anxiety about erectile dysfunction, what basically happens is the individual tends to look down at his organ. So, a variety of questions, basically runs in the individual's heads. Okay, so what are the doubts that a man with performance anxiety, commonly has? Okay, am I going to get my erection today? Will I be able to satisfy my partner today? Will my erection sustain enough? Am I a man? And that, the questions go to the extent of even questioning one's complete self-worth. Am I even fit for this marriage? Should I be in this relationship? So it can go to that extent, a small thing, such a small thing, it can be ballooned up to, a disproportionate size of worry. So what happens is basically some of these individuals are actually patients who have generalized anxiety disorder. Now, to cope up with this anxiety or performance anxiety, what you should do, and this is the 4th tip, the most important tip, is try what's called as mindfulness exercises. So mindfulness exercises or mindfulness therapy is about focusing your mind on the present moment and completely it's not about ignoring your feelings or the sensations that's coming in your body. You focus, you look at whatever feeling, you look at whatever thoughts, you look at all those disturbing thoughts that are coming into your attention span or your focus, but you gently look at them and you come back to the present moment. You focus gently on your breathing. So there's a nice app on the Google Play Store called as the UCLA Mindfulness application. What you can do is you can use the application 10 minutes before sexual intercourse and also 10 minutes in the morning as well as before sleeping, about 10 minutes. I would recommend using the application. Why? Because it's a free application. One, it's extremely well certified, and mindfulness therapy has shown clinically to lower performance anxiety level. So when you're mindful, you focus only on the present moment. So that's the whole idea of mindfulness therapy. So it's a set of breathing exercises that basically increases your awareness, increases your attention and focus. And basically what happens is when your focus improves, a different part of your brain fires up as compared to the anxiety systems. Remember when you're in a threat state, so say suppose sexual intercourse, multiple sessions was a failure. What basically happens is your body goes into what's called as a threat response. So every time you try sexual intercourse with your partner, you're going to be worried, you're going to be threatened, and you're going to freeze. So what's going to happen? Your sympathetic system overworks. That means the body has what's called as the sympathetic nervous system and the parasympathetic nervous system. When the sympathetic nervous system fires up, it's erectolytic. That means it's going to kill your erection. When your sympathetic system fires, what basically happens in your body is there's going to be a process called vasoconstriction. That means the blood flow to the penis is going to shut down. You're going to lose your erection, and that's exactly what happens. And because of the anxiety, you're not going to find sexual intercourse interesting. You're going to avoid it. And generally, we notice many men with performance anxiety about erectile dysfunction actually avoiding sexual intercourse. And what's going to happen because of that? Your relationship with your partner is going to be screwed. It's going to be hyper screwed. Your partner is also going to suspect you, and she's also going to feel equally bad because of your problem. So what do you do? How do you overcome this? How do you shut down the brain's anxiety systems? It's by mindfulness therapy, my friends. We have tested it on over 2,000 patients in the better part of 2 years. We found amazing results. Please, this is a one-shot solution. So try the mindfulness therapy application on the Google Play Store. Remember to walk, eat a protein and a fat-rich diet. And I'll give you a bonus tip. The bonus tip is cognitive restructuring. What you need to do is, before sexual intercourse, use the mindfulness therapy, use it for 10 minutes, and maybe take another 10 minutes and think of something that, makes you feel happy. So say if you like playing the piano, or say you like riding a fast motorcycle, or you like driving, or there must be some activity, for heaven's sake, that you really like doing. Try to visualize that. And if you visualize that, what basically happens is a different part of your brain fires up, your anxiety comes down, and you'll be able to perform better in sexual intercourse. What's also very, very important here is that don't take too much pressure. Remember, the sexual intercourse or sex is not meant to be mechanical in any way. So if you're trying for a child, many doctors and many gynecologists, advise guys to, try during what's called as the ovulation window period, that's between the 10th day and the 14th day. Because of that, for many men, they would have had healthy erections when they were not asked to try during the window. But once they're asked to try during this particular ovulation window, again, performance anxiety builds up because sex becomes mechanical. It becomes more procreative rather than recreative. And what's going to happen is a large proportion of men face performance anxiety with erectile dysfunction. So remember, you don't have to make it mechanical. It doesn't have to be mechanical. You can go with the pace. You can do it when you find yourself interested in it. So don't set targets. Don't be hard on yourself. Take it easy. Breathe, relax, take it easy. You're not going to catch a flight or a train. It's sexual intercourse. You can do it at your comfort. So remember that. The reason we have sex is primarily not just to procreate, but it's also to recreate. And what's very important is it should be pleasurable, it should be enjoyable, it should not be, mechanical and, torturous. It's not worth it at all. So take it easy and, try to be open and communicative with your partner. Tell your problems. Sometimes, some men, feel very bad that their partners, kind of comment about the man's erection. They pass verbose comments, which, actually put off the whole session. So if you have a problem, if your partner is doing something like that to you, be verbal about it. Be open, keep open, transparent communications which are gentle. Be firm, but be also kind. And try to, tell whatever you're feeling, you have to speak it out to your partner. It's very important. So these are all things that, these are all the various strategies and, things and techniques that you can use to overcome performance anxiety with erectile dysfunction. I hope you found this video very, very informative. Please remember to try mindfulness therapy, and remember the cognitive structuring technique I taught you. You need to visualize something that you find that makes you happy before sexual intercourse. Relax the mind and then try. And I hope you found this video very informative, and please share this video with all your friends and loved ones. And this is Dr. Shah. Vanakkam and Namaste.